what could change to make this complicated system better? And you're someone who knows it from the doctor side, from the inside. Because, you know, I mean, you hear like doctors complain about HMOs, and it's especially in the last 10 years, they get paid less for the same amount of work, they get more patients, and I think they think the only people in winning are the insurance companies, or how does it work? And also, what's the role of money within medicine? There's an idea as well, medicine is this noble act, and when profit and so forth gets involved with it, it can corrupt the intention, mess up the system. Now, on the other hand, you have costs. You need to pay the doctors well. You know, you need to incentivize people to do well and go to nice hospitals. So I wish they'll pay more. So where do we fall within all this?
So I think basically it's coming down to, and then I know we're trying to avoid politics. I'm not going to go down party lines here, but you know, government getting involved always makes things more complicated. And so you basically have, well, government needs to have oversight versus free market principles. And I think there are a handful of practices that do practice the free market principle. They don't do anything with insurance companies. They, you know, give the patient a bill that's, you know, appropriate. When you start getting involved with insurance companies, there's a lot of additional bureaucratic costs. So those costs can kind of be eliminated in this free market system of, you know, here's the bill, this is what we can charge, and then you can say, well, the, you know, practice across the street is going to charge this, you know, that kind of principle, the free market principle. If we are truly running medicine as a business, and I'm not going to deny it, there is a business component to it. Having a free market kind of capitalistic type style may help to alleviate a lot of the abuses and over expenses and cost of medicine that way. The other aspect is from the pharmaceutical end, the United States gets charged 10 times more than the rest of the world, and there's this concept of, well, we're financing the rest of the world to get their medications because the governments around the world have really regulated the cost. And in fact, the pharmaceutical companies have a very large lobbying group in Washington, and so if you were to eliminate or be able to cut drug costs, I think that would have a substantial benefit in terms of you know, how you could help control costs in medicine.
Does cutting the drug costs come from embracing the free market principle, or does it come from a government regulatory angle?
I think in that case, it's going to be both, because right now they are acting on free market principles here in the United States, but not the rest of the world.
Mm-hmm. And that's leading to,
that's driving
in this situation it's bad because the costs get higher. That being said, they make more money, they can fund more research, which then they can make better drugs and then export those to the rest of the world, which has it at subsidized prices. So it's so complicated.
It is so complicated.
And so you think you've got the answer, but
the
then
way
there's
the
another
government
side to
can
it.
get involved in probably a beneficial way is to absorb a lot of the trial costs that the pharma companies have to put out, because they will have to pay tens of millions of dollars to get a clinical trial done right per FDA standards to get a drug approved. Mm-hmm. And maybe if the government were to absorb some of those costs, that could help to keep those costs down, because then you can drop the price of the drug and still the pharmaceutical companies can make a profit and still, you know, keep their R&D going.
Okay.
Right now, that's the big thing. We have to charge this much because we have a lot of research and development. We had to put tens of millions of dollars. And if they put tens of millions of dollars into a trial and the drug is negative.
Right. But that's why they need a lot of R&D money.
Right.
Yeah.
And, you know, academic centers and universities and hospitals they have staff that help to work to keep all the documents for patients enrolled on clinical trials. And it's a rigorous process. And, you know, it's like, that cost has to be covered somehow. And that's one of the major trial costs. And so some institutions are known to say, well, we'll open your trial, but you got to give us $20,000 per patient. And then other smaller practices say, oh, we'll do it for, you know, $2,500 a patient. So it's a wide spectrum across the board that's driving up the clinical trial costs to meet very specific FDA standards for getting drug approval. and I think maybe that's where government should get involved, as opposed to just saying, oh, we're going to do Medicare, Medicaid, and is it Obamacare? Is it single payer? I think, having some aspect of regulatory with the free market principle is going to work, but it can't be that we're the only country in the world with that free market principle, and the rest of the world is being able to benefit from that, but we're paying the tenfold.
It's because our companies here are doing the R&D. That's why the other countries benefit.
Well, other pharmas around the world, I mean, in Europe, they have their own R&D as well, but and it also depends where they run the trial. If they run the trial in India versus China versus some of these other places, as opposed to like Europe and USA and Canada, that's certainly going to help keep their costs down by running trials in those countries like that. But I think that's one of the biggest things. If they can keep clinical trial costs down, I think that can help to drive pharmaceutical prices down as well.
Which could end up making healthcare more affordable for more people also, provided there's not a universal healthcare system. Okay.
Yeah.
It's so multifaceted.
Yeah.